Good morning, everyone, and welcome and thank you for tuning in to Health Talk. I'm Dr. Victor Politi, the President and CEO of New Health, the Nassau University Medical Center. As healthcare in America is changing, New Health is part of that change. This half-hour program will provide you with some essential information about our services and facilities that provide top-quality care that fits into your lifestyle. New Health's roots go deep into Long Island's history. What began in 1935 as a 200-bed general hospital has now become part of a unique health organization with multiple centers of care and a commitment to deliver excellent, essential care to everyone at every stage of life. You already know us as Nassau's premier Level 1 trauma center, but we have so much more to offer the community, including a full-service, state-of-the-art center of care in Nassau County at our A. Holly Patterson Extended Care Facility, as well as our New Health Family Health Centers, which are the federally qualified healthcare centers here in Nassau County. So our continuous improvements are making us a leading provider of both primary and tertiary care services that rival the best in the country. Everyone sees Nassau University Medical Center on Hempstead Turnpike. It's that big 19-story building. You know it's there. It's a trauma center, ambulances, helicopters, fire departments. That's their location that they bring their patients in their most time of need. So not only do we provide those emergency services, but we have a full hospital with many different subspecialties. And today we're going to talk about one of those subspecialties, one that most hospitals don't have on hand, which we have at Nassau University Medical Center 24 hours a day, 7 days a week. Specialists that really are difficult to get, whether it's in dermatology, whether it's in burns or plastic surgery, any of these specialties, cardiology, pulmonary, infectious disease. But today we have some special doctor today, and we'll be talking about her specialty and what services she provides at Nassau University Medical Center. So today it's our pleasure to have with us our chairman and program director of our Department of Ophthalmology, and that's Dr. Marcelle Morcos. Dr. Morcos, welcome and thank you for being here today.
Thank you. I'm honored to be here with you, and it's a great day to be talking about the ophthalmology department at Nassau University Medical Center.
Thank you.
Our ophthalmology department started back in 1972, and we've been serving the community for all these years, and we deliver excellent patient care for every subspecialty in ophthalmology. We take care of patient, baby to all ages of patient, all sort of problem, and we deliver full service of ophthalmology, from surgery to refractive to plastic to glaucoma to cataract, any diseases of the eye. We're there. We have specialties and subspecialties devoting their time and their expertise to deliver the best care for all ophthalmic needs.
That's amazing. And people, know about ophthalmologists, they know about eye surgeons, but what people don't realize how much training you actually go through to become an ophthalmologist. So just to go through the regular sequence of events, someone will go to college and they'll major in biology or the sciences, and they'll have to take all those courses like organic, general chemistry and physics and calculus and do really, really well and have a great GPA. Then they have to take what's called the MCATs, which is a medical entrance exam, and you have to do very, very well on that, and then apply in a really competitive world to become a physician. So you go to a MD or a DO, which is Doctor of Osteopathic Medicine school, to become a physician. So that's 4 years of college, then 4 years of medical school, and then even after the medical school, you then have to do an internship and residency, and that's where ophthalmology comes in.
Exactly.
So
you're absolutely right. And the internship is an intensive year of training, but after that you have to spend 3 years of training to be an ophthalmologist. And after that, if you want to be subspecialized in retina, glaucoma, refractive, plastic, neuro-ophthalmology, you have to spend another year or two to become subspecialist in the choice of your field.
So that 1 year, that internship, that's when they really earn their stripes and scars. They work those late hours and they spend all weekends and holidays in the hospital, providing general medical care to patients. And then 3 intensive years working with you, because you do have residents in your program, correct?
We do have residents, and our residents are the top on the country and the top on Long Island. We choose the best candidate, and they're usually the top of their class in medical school, And we have 4 residents a year, and they spend 3 years with me, and with all the subspecialties that we have. After that, they go to fellowship.
Fellowships. And I understand your recent graduates have gotten some really prestigious fellowships.
Absolutely. The 4 of my graduates, one went to medical retina in Florida, in Miami, and one went to surgical retina 2 years in Texas, and one went to glaucoma in South Florida, and another one went to refractive surgery in cornea with ophthalmic consultant of Long Island.
Wow, it's a great group too.
They are
Oakland is
wonderful.
an amazing group of ophthalmologists here in Long Island, and they are associated with us as well.
They are
correct?
our group. They deliver service to our patient. They cover a lot of our clinics, and they help the resident in their education. And they wonderful a group of specialists, and they're the top in Long
So
Island.
usually doctors go to medical school and they graduate, and then they want to do residency. And in the hierarchy of residencies, there's so many choices. People, who love children become pediatricians. People who love very challenging mental cases become, internists. People who like psychiatry become psychiatrists. But usually the cream of the crop choose certain specialties, such as dermatology or maybe radiology and ophthalmology. And so you have some of the best young residents in their fields coming into this program.
Well, that's true, and they're very special people because they're very patient and they're very dedicated and they're very focused. Working in ophthalmology is not an easy field to work in because medical school doesn't prepare our graduate in medicine to know much about ophthalmology. When they come to ophthalmology, it's a whole new field. They have to know the anatomy of the eye, the physiology of the eye, the pathology of the eye, and the refractive and the optics of the eye. It's a whole new world, as if they're going through another medical school
'Cause
to know about the eye.
Think about it. You're an accomplished surgeon, and I see you in the operating room all the time, Dr. Marcos, and your patients absolutely adore you. The other physicians in the hospital refer to you and refer our families to you. I mean, that's really, you've achieved something that I think most physicians, most people in their lives would love to achieve, a status such as yours as being, enamored by their peers. Their peers really hold you at a high standard. And you personally train these physicians.
That's true. I am honored to be in that position. As a matter of fact, I went through this training in Nassau University Medical Center. I am the product of Nassau University Medical Center when it used to be Nassau County. And so my love is deep, and my devotion to ophthalmology and to the eye, to vision, is what drove me into the field of ophthalmology. Vision is the most important sense, and to lose vision is a devastating entity for any human being to have or to have and lose. So my life is dedicated to preserve vision to everybody who come into our doors, and this is my quest, my aim in life, to do the best I can to every human being to preserve the vision.
If you think about it, you're doing surgery on your eye. Now, the listeners, look, that's your eyeball. I mean, you actually go in there with scalpels and things, and you look around and you fix a detached retina, or you repair a muscle, or you get someone's vision back. And I've never seen anything that was so dramatic as a person who comes in for example, cataract surgery, and they can't see, and there's just looking through clouds, and they can't even make out faces. And after just a few hours with you, they walk out of that emergency room, out of that operating room, and recover, and they're seeing, and they could see people, and it's such a dramatic change in their life. They couldn't drive before, they couldn't walk down steps, and all of a sudden, with a little surgery, with your expertise in doctors of ophthalmology, they're able to see again. What a dramatic and a life-changing event that is.
And that's what keeps us going. The effect of the surgery, and the surgery nowadays is much improved because we do the surgery through a very tiny incision, 2 millimeter incision. We take the cataract out and put the lens implant in, and the patient can see the second day. It's not only the elderly who get the cataract. A lot of people get the cataract because of some diseases or genetic or medication that they have taken sometime during their life that they develop cataract. Trauma. We have people with trauma. We have people from the psych floor that they were admitted because they couldn't function. They have, and when we examined them, it was the cataract that made them the way they were, and when we removed the cataract, they were able to be discharged from the psych floor. Vision is a gift from God, and it's the most important, valuable sense that human being have.
Yeah, and it really is amazing. And most of your work is done with microscopes, right? You're actually
Absolutely.
working under a microscope, binoculars, and
Under the microscope and with machine, with laser, with ultrasound, because through the small incision, we introduce a probe to remove the cataract with an ultrasound, or to do laser through the small incision again and put the implant in, and the patient is ready to see right after the surgery. The vision will be back to where they were 20 or 30 years before the surgery.
And I understand some of your surgeons and residents go overseas to impoverished areas of India and Africa and South America and volunteer and do, literally hundreds of surgeries on these patients for free.
Yes, I went myself to India in January with some of my residents, and we participated in one of those cataract camp, and it was amazing the how many people are devastated with cataract everywhere in the world, and with a symbol in our hand procedure, we can give them their life back, and that's a gift from God, and we appreciate and we honored to be in a position to help people.
And it's truly a great thing that you do for them, as well as for National University Medical Center. You take our residents, you take the doctors, you take the attending physicians, and you guys go away to these countries and really make a huge difference in their lives. I've seen pictures of the line of people that just lined up waiting to come see you guys, and you see every single one of them, which is absolutely amazing.
Yeah, we do that here too in Nassau University Medical Center. We get patients from the airport coming to Nassau for all their problem. Yesterday we had the one walk into the clinic with a tumor in his eye. Every day we have people coming from everywhere in the country to ask for help and to reach for the expertise we have. We have a specialist for every subspecialty. In the ophthalmology, we have retina specialists, the top in the country, professor from Columbia. We have anterior segment specialists from NYU. They work with the resident and they help. We have glaucoma specialists, several. We have strabismus specialists for children who have crossed eye. And we have a neuro-ophthalmology specialist and plastic specialist. Thank God, the department is full of expertise, and their aim is to deliver the best and excellence in ophthalmic care.
And people in Nassau County don't realize that. We have a lot of choices for healthcare in Nassau. We have a lot of great hospitals here, and we're really blessed in Nassau. I mean, probably better than anywhere else in the entire world, that we have such very experienced doctors and great hospitals right here within miles of each other. And Nassau University Medical Center, right on Hempstead Turnpike, people don't realize, they have a lot of choices. And Nassau University Medical Center at one time was the Meadowbrook Hospital and had, didn't have the reputation that it has today. But today, in 2015, I hear you talking. I know the doctors you're speaking of. You're bringing in such qualified physicians, all who are super specialists to take care of these patients, and they're here at Nassau University Medical Center, available to the people in East Meadow, to the people in Freeport, to the people in Uniondale and Westbury and Garden City. We're here for them, and they don't realize that just by coming here and seeing you, that they're going to get this top quality care. And that's what we have to let people know. That's the message I'm trying to get out, is to tell people that Nassau University Medical Center, whether it's in your department of ophthalmology, or plastic surgery, or dermatology, or internal medicine, cardiology, GI. We have the top trained doctors, experienced physicians, and some of the top equipment, the highest quality technology in our hospital available for them. And so I'm trying to change that opinion of Nassau University Medical Center, and every day I get thank yous from patients. I get letters, commenting on the care that they received here. And hey, listen, it's a big ship. We're turning it around. There's a lot of work to do, but we're working on it, and I think we're making amazing improvements in the hospital itself.
I couldn't disagree. Since you came to the department, you have been a wonderful leader. You spend endless time supporting every department, supporting us with all the new technology to deliver the best we can. And every department appreciate all your effort and your dedication to medicine.
Right. Well, thank you, Dr. Marcos. And there's so much more to do. But after your doctors now, you were saying all these subspecialists, so they go to the medical school, they go to their 4 years with you as a resident, then they have to do a specialty, another specialty for a year or two in oculoplastics or retina. So these physicians, they're old when they get out. I mean, they already went, and I say old, I mean, they're in their 30s already by the time they even start to practice. So they've gained a lot of maturity, and for the last 10 years of their life, or 12 years of their life, they have been so focused on just working in medicine that they come out ready to go and eager to go. So your residents now have taken some 4 really prime fellowships. And I think through the years, your residents have always achieved really great positions in fellowships. Hopefully, they'll all come back and work with us.
We hope so. We have few who come back and is working with us, and they're wonderful addition to the department. And we have residents who went through every other state, and they're the top wherever they go. I have several associate professors in every institution now in the country, and they keep National University Medical Center high everywhere they go because they deliver the best care, and they are trained to be caring and supportive to their patient regardless of their means of life.
How would someone make an appointment with you? How would someone go about seeing someone at our hospital?
They call the hospital 572-6646, and there's always people there to help make the appointment for them.
So that's, what's that, 572?
572-6646.
Okay. I also have a 516 area code, 486 NUMC. That's 516-486-6862. That's the general hospital. That's to make appointments for any specialty, cardiology, you want to get a stress test or a colonoscopy or any type of exam. So, there's some confusion, not confusion, but maybe you can explain to me the difference between an ophthalmologist and an optometrist.
Well, an ophthalmologist is a medical doctor. He have to go through to be a medical doctor before he go into 4 years of ophthalmology training, 1 year internship, and straight 3 years of ophthalmology, and maybe another year or 2 for subspecialties. Optometrist is an they do care for eyes. They can examine the patient, but they cannot do any surgery because they are not physician. They cannot. There is limited of what they can do. They can examine the eye. They can take picture of the eye. They can prescribe glasses to help the general population for just the daily need of refractive error or some minor inflammation or a little allergy. Other than that, they're not qualified.
So they basically, and we see a lot of them. Those are the eyeglass optometry stores that are in every community, and so if I need eyeglasses, I'll go to them, and they can refract my eye and determine what my vision is.
And they're great as a doorkeeper because when they see something problem, they always send them to us.
So do they dilate the eyes as well?
They dilate the eye and they take images. They allowed to do that. And when they see some pathology or something away from the normal, they always refer them to the physician, eye physician.
If they have high pressures and glaucoma, or they find a cataract, or worse, a tumor on the retina,
they refer them.
They refer them to you, and then you'll do the surgery to correct that. So they're very valuable. They're very valuable in the community to actually, as a screening tool, to first to help people see, because they give them the glasses if there's no pathology. They give them they give them some really great frames with some designer names, and you look at your whatever kind of coverage you have that covers for your eye plan, and if they find something, then they'll refer them over to you, because that you always see OD, which is a optometry, doctor of optometry, and then you see a MD, which is medical doctor, ophthalmology, or DO, doctor of osteopathic medicine, as an ophthalmology physician as well.
Yeah.
So that's kind of confusion. A doctor of osteopathic medicine is a DO, but an ophthalmology doctor is an OD. So sometimes people get confused. What's the, DO or OD?
It's not, there is not too much confusion because doctor of osteopathy is a doctor, is an MD.
MD,
He spent
right.
4 years after college. After
Right.
the 4 year of college to
So they're
become an MD,
physicians.
he's a physician. And then he spent another 4 years to become an ophthalmologist.
And then another 2 years
Another
to
2
be a
years
specialist.
to be a specialist, super specialist.
Super specialist, right?
That's true.
And it is. And it really, look, if you're dealing with my eye, you better really be good. I mean, I wouldn't let just anyone come around and start poking around in there and, doing things. You really have to be good. I mean, look, I mean, I'm not taking anything away from our GI doctors doing colonoscopy. That's kind of sensitive too, or urologists, or all these surgeons are amazing and physicians. But when you think of your eye, someone fooling around there, I mean, I can't even put a drop in my eye without squinting. Never mind go through surgery.
It's a very precise field that demands full concentration and full cooperation and steady hands.
Mm-hmm. They do a lot of robotics. They have robotics in ophthalmology. I know they're doing a lot of in surgeries, microvascular surgeries and stuff.
We have like computerized machine that we can use, but it is still it's a very, remember, we're working in an inch of an organ.
Mm-hmm.
And that little organ have so many structure that goes by cells. Cell layer by cell layer make a difference in patient vision.
Mm-hmm.
And nowadays we have a lot of tools to show us the whole eye, cell by cell, layer by layer, and we do have that technology in Nassau University Medical Center. We have the OCT, and we have ultrasound, we have cameras, we do fluorescein angiography to look at the healthiness of the circulation within the eye. And with the OCT, we can see the layer of the retina.
OCT?
Layer, yeah.
What is?
That is it's a special computerized machine. It's like the CAT scan, but it is done by light only. There is no. It's not like the MRI that's magnetic. It's done by layer, and it can show you layer by layer of the eye from the retina to the cornea, and you can tell where is the pathology.
Sure, because they say the eye is just an extension of the brain, right? The retinal artery.
That's true.
The retinal
nerve, the nerve goes straight
nerve.
to the nerve.
Sure, right into the brain.
That's it.
No, amazing stuff, and really, what a really special field of medicine that you have, and to know that Nassau University Medical Center has that right there on Hempstead Turnpike, and that you're available there, and that your physicians are some of the best known in the city and in Long Island to take care of these patients. Is it hard to get an appointment? Are you guys really crowded and busy, or?
We're busy, but it's not hard because we work 24/7, and we have over 30 specialists available to deliver the care. So emergency, we see them instantly, and regular appointment, it can be within a few days. We're available.
So I know our emergency room is a level 1 trauma center. We receive a lot of car accidents, assaults, people get punched in the eye, or a baseball game and a child gets hit in the eye with the eyeball and they fracture maybe one of the orbital bones and maybe have some entrapment of the eye. And this happens all day long in the emergency department. And you're available in that hospital?
We see them all.
They
come right to the emergency room. Our resident examine the patient, and if there's entrapment, we have oculoplastic ophthalmologist on call, and he see them and he fix them.
See, and that's what's great about the hospital. There are a lot of these urgent care centers that developing everywhere in Nassau County. We can't go a block without seeing them, and they're great and they have their purpose. But people still have to realize that they need that emergency department or that hospital, because we have the resources. If you have a sick child and you go to one of these doc in the boxes or urgent care center, and you'll see a physician, but when you come to Nassau University Medical Center, you come to the emergency room, you're seeing a pediatrician. If you break your bone, you could see the doctor in the clinic, in the urgent care center. But if you come to Nassau University Medical Center, you're going to see a board-certified orthopedic surgeon. Or an eye injury, you can go see a great doctor in a doc in a box, and that's great. But guess what? You come to the ER at Nassau University Medical Center, you're going to see 24 hours a day, 7 days a week, an ophthalmologist. And that's the difference between when you go to an urgent care or a doc in a box as opposed to National University Medical Center, is that you're not just getting, for an earache or a sore throat. That's great. Everybody can give a prescription or take a look at you and make a viral diagnosis, or, belly pain that's nothing more than, constipation. But anything more than that, and there's something that requires a specialist or some special scanning like a CAT scan or an MRI, we have it. And speaking of CAT scans, in the CAT scan in the emergency department at National University Medical Center, it's what they call a 320 slice CT. That's the highest level of CTs of any emergency department in Nassau County. It's so fast and it's so specific that it actually picks up the beating heart and the blood traveling through the heart. So people with chest pain, we can do a CAT scan of the heart and see if there's any blockage in one of those arteries. So we have all that technology, and to know that we have a service like yours available just brings us to a very high level in Nassau County. So, I thank you for all of that. There's so much more we can deal with. There's so much more we could speak about as far as where we're going, as far as where the hospital is, and to have something like ophthalmology there. It really helps out. I mean, everything, even a small thing like small thing, it's a big thing, dentistry. Yesterday we had a friend calls, says impacted wisdom tooth and a lot of pain. What do I do? So we say, come right to the emergency room. Let's see what you got. And so the person presented to the emergency room. The emergency room doctor examined the patient, and she had a big inflamed, impacted wisdom tooth. And guess what? Within minutes, we had an oral surgeon in the emergency department. Within minutes, they had her downstairs in the oral surgery suite, and they removed the tooth. And they put her on some medication and some pain meds. And I would say a couple of hours later, she was on the way home. So how do you get everything like this?
You removed mine too a few years back.
Yours too?
That's right. We have one of the top specialist orofacial maxillary in the country.
We do. Dr. Sedoff.
Yes.
As a matter of fact, anyone listening, if you ever go on to the www.numc website, you can actually click on one of the things on the side there that say videos. What does it say, Shelley? It says videos?
It says news, under news.
Under news, and you click on that, and all of these different shows that we're doing here, this Health Watch show, Health Talk show, all the different Health Talk shows that we're doing are on there. And Dr. Sedoff was actually on one of those shows.
Okay.
And anyone who wants to learn about medicine or wants to know about the services we have, if they go on that website, www.numc.edu, and look at it, you can see the Health Talk, and you'll see the thing that says videos and all that stuff, news. Click on that, and you can pick out a specialty. And we have all different doctors. I try to bring as many different doctors as we can here. And also some interesting other people like the police commissioner and some local legislators and other people. So you get some really interesting people on that thing. You can see what they're about. Especially if you have children that are looking to go into medicine, or someone that that's interested in being a nurse or doctor or PA, or even an optometrist. You can go on that website and basically take a look at all these different shows. So it's interesting. And I try to be interesting, such as with Dr. Marcos. I mean, you are amazing.
Well, thank you. I really appreciate your thinking of me that way. Mm-hmm. I am just a humble graduate of Nassau University Medical Center.
You really
and
are
we
amazing.
Have a lot of medical students come from all over the country to do rotation with us. Yeah. And we're happy to be of help and education because it's all community service and preparing for the future to have the best eye doctors.
Well, you're certainly a role model. You really are. And I can see that, why the students really gravitate to you, and why your residency is so highly sought after. So anyway, wow, amazing. Wear your sunglasses, protect your eyes. You don't ever want to lose your vision. And eat your carrots. Is that true to that? By the way, eating carrots?
Yeah, vitamin A is very good.
I used to eat a lot of carrots. I'm still using, but I still got to use reading glasses. I don't understand.
Well, we're all getting young. We all need reading glasses.
You never seen a rabbit with eyeglasses, what I understand. So, all right, so I'm Dr. Victor Politi. I'm the president and the CEO of the hospital at Nassau University Medical Center on Hempstead Turnpike. It's a Saturday. It's a summer. I hope everyone stays healthy, gets outside, you're active, enjoy it, and just in case something happens or you ever need us, we're here for you at the National University Medical Center. You can always call us at 516
572
Oh.
6646.
6646 or 516 486 NUMC. 486 NUMC. And so, again, Dr. Politi wishing everybody a great, great day. Stay healthy, and we're here if you need us. Thank you.
Thank you.